Hey, g'day folks. Welcome again to Dr. Dave's weekly Healthy Bastards health tip. Now this week, again, we're talking about that thing that everyone is scared of. You know what it is, don't you? Now last week in my weekly Healthy Bastards health tip, I told you what is cancer in common man's language. This week's weekly Healthy Bastards health tip is how do you treat cancer generally. I'm not talking about individual types like bowel or lung or prostate or breast cancer. I just want to cover the general types of treatment, which is surgery, drugs or radiotherapy. So again, with the help of Richard Isaacs in our award-winning, Oscar-winning Healthy Bastards movie starring myself and Brad Pitt, we'll show you what is cancer treatment generally. Then next week and the week after, we'll look at different types, okay? So please, after this video clips come through, spread this viral for us. Thanks very much, everybody. See you later. Three main forms of treatment that you decide as an expert with your friends is chopping out, surgery, drugs, or radiotherapy. What is radiotherapy?
So radiotherapy is it's like, think of it as being spot welding.
Yeah.
It's firing a very carefully focused beam of radiation through a part of the body that causes more damage to the cancer cells and to normal cells in that area, but the normal cells repair themselves. The cancer cells are so wild and woolly they can't, and they'll often die. It's very localized treatment. You'll get temporary side effects from the effects of the radiation on the normal cells, but it does seem for prostate cancer to be just as effective as an operation.
So the treatments for either lung or prostate are getting better all the time, aren't they?
Yep.
So the main thing is for people not to be scared. If they get the symptoms, find out if you've got cancer. If you've got it, you'll get to see an expert.
Absolutely, see an expert. They'll discuss it with other experts and they'll give you the best treatment they can.
Because the thing I find as a GP is a lot of people are put off with scare tactics, but often it's old treatments that nobody uses anymore.
You're thinking about like chemotherapy?
The drugs, but also like the prostate where they chop it out and there's all sorts of side effects, but there's better and better forms of surgery now.
They're doing surgery more effectively than they were years ago with less side effects. There are still some risks, and obviously you discuss that with your surgeon. But and the same with radiotherapy, they can both affect your male function, and you'd want to talk about that with the specialist.
So if you do get a course of drugs, do you give it here? You do. So you'd get the patient, the cancer sufferer you'd give it in a...
I mean, most of the treatment is given in the public hospital. In a room that would take about 12 different people and different lazy boys. They're sitting there, it's quite normal. You'll go in and have your treatment as a day visit, usually only for an hour or two. And we use, there are lots of fears related to chemotherapy with the hair loss. Can't prevent that. With some drugs, but it only happens with some drugs. And you don't say anything about me, mate.
Have you had chemotherapy?
I rub my head on the pillow.
I've had it too.
Grows back as thick as ever, mate. Everybody. Nausea and vomiting is a big fear. Most people's vision of someone on chemotherapy is a bald, skinny person vomiting. And what we find now is that the vomiting is almost completely prevented with new drugs. In fact, the biggest risk for weight when you're having chemotherapy is putting weight on, because you do feel a bit more tired. And the hair loss is reversible, so it's normally a number of weeks of treatment, and then you get on with the rest of your life.